Hi everyone, and welcome. For those that I haven't met yet, my name's Josh Marshall. I'm the General Manager of Crucial Dimensions. We're the exclusive partner for Crucial Learning across Australia and New Zealand, and we support organisations to build capability in communication, accountability, influence, and leadership. And there's a lot of familiar names I'm seeing join us, which is great to see, and a big welcome to those attending one of our webinars for the first time. I'm really pleased to introduce today's session with Emily Gregory, who's one of the authors at Crucial Learning and also a key thought leader there as well. And we're looking at her insights, and you may have been on our previous webinar, which looked at from talk to transformation, which was really looking at the role of communication in wellbeing through crucial conversations. We're now rolling into the webinar today, which is really exploring effective dialogue and combining the 6 sources of influence framework and how that can be used to shape and strengthen wellbeing and organizational culture. So just in terms of a bit of rules for the webinar, look, the chat will be open throughout. So please feel free to share comments, reflections as we go. It'd be really great to get your engagement. We'll also run a few quick polls through the webinar. So please just join that and engage. And we'll also hold a Q&A at the end as well. So if you can just hold your major questions till then, that would be great. So look, thanks again for joining us. I really appreciate the time you're making, and I'll hand it over to you, Emily.
Lovely. Thank you so much, Josh. And welcome, everyone. I'm so delighted to be here with you. Good morning to you all. It's a good evening for me. I am joining from the States today, but just delighted to be with you all. I would love to get a quick sense from the room of where everyone is joining from today. So if you would open up your chat and just chat in a hello and where you're joining from, it would be great to see where you all are. We are going to be using the chat. This is fairly interactive for a quote unquote webinar here. So excited to see this. So Brisbane, Perth, Sydney, Auckland, wonderful, Adelaide, far north, old Australia. Wonderful, wonderful. Some more Brisbane, Adelaide, Sydney, County Victoria, Melbourne, Sydney. Wonderful, great. Okay. Wellington, lovely, 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 lovely. So yes, feel free to just, as you join, it's great to see we've got all corners here that people are coming in from. So that's wonderful. Well, as Josh mentioned, I have been with Crucial Learning for nigh into 20 years now, and I'm so excited to join with you again. Hopefully, some of you were able to be on our session around Crucial Conversations, and I am looking forward to this next one around how we can really leverage the 6 sources of influence to shape our organizational cultures, specifically with an eye towards increasing well-being, like not leaving that to chance, but to really orchestrating and organizing around employee well-being and organization and cultural well-being. So that's what we're going to talk about today in our hour together. And to get started, just thinking about influence and how we influence behavior and influence people's behavior to change, I have a little thought question for you. So this is probably a little bit of outside the realm of your normal day-to-day work experience, but we can use our creativity here as we think about influence. This is a real life example from All Nippon Airways, a major global airline based out of Japan. Some years ago, their crack team of researchers calculated that if passengers on their plane, if every single passenger that boarded one of their planes would do just one thing, engage in just one behavior before boarding their planes, they could lighten their load by 240 pounds on every flight, which actually could, over time, reduce both their carbon footprint and their fuel costs, right? If we can lighten the load, we need a little less fuel to go that direction. But again, this is an influence challenge, a challenge around behavior change. They had to get every single passenger to do one thing before boarding that flight. So here's what I want to do first. Just chat in if you can. Guess what is that one thing that they need to get every single passenger to do? Yes, exactly. Yes. We start all doing the calculation like, oh, if I go to the toilet, if I go to the bathroom before, about how much weight do I lose, right? Absolutely. Yes, it was use the restroom. And again, we're not even making this up. They did the research on this. So here then is my next question for you, and would like you to chat in on this as well. I'll give you a little more time on the chat on this. If you were in their seat and you wanted to influence every single passenger to use the restroom before boarding the plane, what would you do? What are some of the things that you might try? Let's get creative. Let's brainstorm here and use the wisdom of our room, of our Zoom room, to think about how could we influence the behavior of all of our passengers. So go ahead and take a moment, chat in. What are some of the things that you could do to try and influence these passengers? Just go to the restroom. So, okay, I love it. Provide a drink beforehand, engage with their why it's important, give them money. I love it. Kylie's like, just give them money for it, right? I would do a lot of things for money. Going to the restrooms is one. Angela, make the restrooms a fun place to go with memes and music. I'm like seeing like a disco there feeling going on, Angela. I love it. Have Paul, very practical. Have the toilets by the boarding lounge, right? So you don't have to like go all this different way. Sandra, she's getting real here, friends. She's getting real. She says, oh, I've lost it now, but it was basically you have to make them pay to use the restroom on board the plane. If they really want to, they're going to have to pay for that. So I love that. And Kylie's coming up with the ever good running water. Can you just imagine all the like fountains and running water walls and stuff and all the tinkling sounds that might urge us. Give air points, right? Okay, excellent. I love it. And Nicola, the complaint of women everywhere. Have more accessible restrooms for all of the women, right? So that the lines are not long as we're queuing up to that. Okay, I love it. So many different ideas that we've had here. And we'll come back to this in a little bit. But the point I want to make out of this is we all, whether we think about it or not, we have a way of thinking about influencing the behavior of others. We have strategies and tactics that we have done in the past that we think of when we come to influence challenge. So a lot of ours, right, were about, I would say, about the environment. They're about putting in water fountains and making the bathrooms more accessible or approachable or fun or giving points or charging money, right? We tended to, in this group, it looked like at a glance, think a lot about the structural environment that we live in and how we could use that to nudge behavior. And that is great. We're going to come back to that and talk about where that fits. But the challenge is, even though we often have a way of thinking about influence, what happens when we get new influence challenges is that often we get stymied or stuck because what many of us don't have is a systematic, scalable, replicable way, a model of thinking about human behavior that allows us to bring together really robust influence strategies. So that's what I want to do today, is give you we're going to kind of flesh out the model with some of the ideas that you've started here with in the chat. And as we think about that, I want to just be very specific up front about what we mean when we say influence. Because sometimes when we think influence and we think about influential and being influential, and I have a lot of influence, we think about it almost as like persuasion, right? Like I'm going to persuade someone to do something. But influence, as we talk about it here, and in the context of creating an organizational culture, is really the ability to change behavior, right? It's not to get someone to say yes or no. It's not to persuade someone. It's to change behavior in a, again, systematic, sustainable way. And it's important to note that we put here in service of an important goal, right? We want to move our organizations toward, in this case, as we're talking about today, greater well-being or other important outcomes. And if we're going to do that, we have to be able to influence the behavior of the people that work in those organizations. So as we think about that, I just want to do a quick check-in and reflection here with you all. And I'm actually going to ask my my partner here, Amy, who's on with us today as our producer, to launch this poll. So she's going to launch a poll, and I want you to think about, it asks you what you would do if you had more influence. What are some of the challenges or the pressing issues that are facing you or your organizations that if you could change behavior, you would do these things? So the words on the slide, I don't even need to read them because they're going to be the same as what you see on the poll. And I want you to just go ahead and answer it. It should be a multiple choice, so you'll be able to answer more than one. And then you'll notice on the poll, there's also a place for other. And I would love you to chat in if there's something on that's not on this list that you should think, oh, this is the most pressing influence challenge we have in our organization right now. I'd love to have you chat that in. And so, Amy, we're ready to go ahead and launch that poll. Perfect. And maybe I'm not seeing it yet, but that may be, oh, there we go. Okay, there it is. Wonderful. Great. Okay, so there's your poll. Hopefully you are seeing it and you can go ahead and answer it in. And Amy, just let us know when we probably won't wait for everyone to get an answer in, but we'll give you all a little bit of time. And then when we get to about I don't know, 70% or so of you have answered it, we'll go ahead and share those results. And again, I'll watch the chat if there are things there, other influence challenges that you're facing or that you'd love to be able to influence in your organization, in your community, in your family. Please go ahead and chat those in. Thanks, Paul. Thanks. Great. Yes. Oh, Christy, great one. Fair pay. Excellent. Okay. And thank you so much. So Amy is now sharing the poll results and you can see where we come. So not surprisingly, and probably very appropriately on a webinar designed around employee well-being, many of you are concerned about employee well-being. So that's great. But also, right, and related to employee burnout and employee retention as part of that. Collaboration across groups within the system, right? Absolutely. So love that. And thank you again. Oh, wow, Helen in the chat. That's beautiful, right? More kindness, less judgment. Joanne, influencing the behaviors of the leaders that that are serving in your organization to be more visible, authentic, and listen. This is great. So thank you so much for this. As you think about this, as we go through the day today, and we'll go ahead and close that poll now. But as we go through the session, I would like you to keep these problems top of mind and think about how this model that I'm about to introduce to you could help you in these specific challenges, because these are the type of challenges that we work with clients regularly with using this influence model. So here is our crucial influence model. And let me just briefly explain it to you, and then we're going to dive into certain parts of it over the webinar. So if you start over on the left-hand side, we have this idea of there are sources of influence. This is how the world works, okay? Like there are sources of influence around all of us. And those sources of influence around us, they drive our behavior in certain directions, right? They influence our behavior. We are impacted by the world around us. And based on that behavior then, though that how we show up every day and the behavior we exert has a powerful driving influence on our results. So if you read the model left to right, that's sort of how the world works. But influential leaders, true influencers, understand that when you want to influence the world, you need to use the model right to left. So influential leaders always start by saying, what are the results that I want? What are those clear, measurable results that I am looking to get? What is my important goal, right? And then once you've got that, it's about saying, okay, now that I know this is what I want, what is the behavior, right? So moving back a little bit to the left, what are those few vital behaviors that I need to influence in order to drive those results? And once you've identified those vital behaviors that you want to influence, then the question is, how do I organize those 6 sources of influence around my vital behaviors in order to drive my results? So again, you kind of look at the model left to right. That's how the world works. We have sources of influence. They impact our behavior. Our behavior has a direct impact on the results we achieve. If I want to influence, though, I start on the right. I start with the results I want. I backtrack into the behaviors I need to influence, and then I think about the sources of influence around people that I need to put into play in order to drive those vital behaviors. Now, we're going to look at a few different parts of this model, and I want to start with just a little touch on vital behaviors, and then we're going to spend most of our time on the sources of influence. So this is our next chat in question. Here's what I want you to do for just a minute. I want you to imagine that your darling daughter has just come to you and said, guess what? Mom, Dad, guess what? I'm engaged. I'm getting married. I'm so excited. This is amazing. And I would love just one piece of advice about what I can do to make sure I have a great, long-lasting marriage. So that's the question. What is the vital behavior, if you will, right? A specific behavior, that advice that you would give your daughter, your darling daughter, to say, if you do this one thing, you will be more likely to have a great and long-lasting relationship. So I'm so curious to see what you all have to say. Chat it in. Think about what is a behavior that you could do every day in your marriage, in a long-term relationship, in a partnership relationship to ensure success. All right. So I always like it when people say good communication, because I'm like, oh, we do crucial conversations. So we love the good communication. Yes. Learn to listen. Always end the day speaking. Okay, wonderful. On mindfulness, wonderful. Okay, live for each other. I love that. Laugh. Seek to understand. Treat your partners with manners. Oh, these are so good. I feel like we should pull them all out of the chat and share them out, or do like a word cloud or something with them. Say thank you to each other, even for the day-to-day jobs. Show gratitude. Be grateful. Honest respect. Okay, I love it. Michael, be cheeky and have lots of fun. I love it. So many good things. So this question of what are the behaviors, the key behaviors that across large groups of people lead to more successful, in this case, marriage or long-term partnership relationship outcomes. This has been fairly well studied by this man right here. This is Howard Markham. He is an amazing marriage researcher. And for many, many years, he has been studying what makes successful marriages. In fact, he has what he calls the Love Lab. And he does something really interesting. This is where kind of his research started. He would bring married couples in to his love lab, and he would set them up to all sorts of monitors, right? Their heart rate, their respiration, all of that. And then he'd put a video camera on them, and he would ask them to talk about something that is a point of disagreement or conflict in their relationship. And this could be something that's like really huge, right? Some big burning pressing issue. Or it could be something like who takes the trash out to the trash bin at the end of the day, right? It could be fairly seemingly small, but just something that was a point of conflict or contention. And then he would watch them. He would watch them and video record them for 15 minutes having this discussion. And then he and his graduate research assistants would code every single second of that interaction. And based on that coding of that data and what they were seeing in that interaction, they would make a prediction. They would make a prediction about whether that couple would still be married in 5 years or not. And Howard Markman, he got really, really good at this. In fact, he and his graduate students and the people that he trained, so it wasn't just him, but his methodology, they could predict with 90% accuracy whether a couple would be married 5 years from now or not, right? So amazingly, and you say, whoa, what are you looking for in that data, right? We all want to know, what is that behavior that if it's there, it's a problem or it's a solution, right? Like, what behaviors are you looking for? And what he found, and this actually aligns with what a lot of you said, was he was looking for disrespect or the presence of contempt in this disagreement. What Markman found was that how we disagree, how we come and approach these disagreements, that is a disagreement is a crucial moment in a relationship. And the behavior we use to communicate, not just in general, but communicate through disagreement, that is the vital behavior that is going to drive those marital outcomes. So if you think about it again, right, this is how we start saying, what is that vital behavior, this one or two handful of behaviors that's going to have a disproportionate influence on our outcomes? We want to impact that vital behavior. There was a very cool study, I'll just say that I thought I came across recently, although it's about a 20-year-old study now, that reinforced this. And I think this is important for all of you because it's Tuesday morning for you all. I think some of you right around 8 a.m., 9 a.m., 11 a.m. or so on Tuesday morning there. So here, this is going to be important for you in about 2 days, okay? So in 2001, they did a study of British adults, about 3,000 British adults in this, and they were looking again at what are some of these crucial moments where how we behave impacts the outcomes of our relationships, right? And in this study, they found that on average, and these were both married or long-term partnership adults, have an average of 312 arguments a year. So kind of close to one a day, right? Common topics, these are not big arguments. Stubble in the sink, toilet manners, taking too long to get ready, nagging about chores, right? These are just like everyday arguments. But here is what is so amazing. 1 in 5 of these adults had considered calling it quits, ending the relationship, breaking up the family and the marriage, right? Ending it because of this argument. And here's why this is so important as we think about crucial moments and the vital behaviors. And this is what I want you to think about a day and a half from now. The arguments happen more often on Thursday evenings at 8 p.m. So mark your calendar, put an alarm on your watch. Beware of Thursday evenings at 8 p.m. Thursday evenings. Yes, of course, of course. Some of us are like, as Francis says, of course it happened at night. Like, of course it happened at night. And towards the end of the week, right? It's like the end of the week, but not yet the weekend. We could probably predict that Thursday nights would be the worst nights right there. Now, as we think about this big idea that I want to share is this idea that we need to start getting really specific about the behaviors that we're looking for and that we're trying to influence. So let me give you an example that's a little bit more related to what we want to talk about. Oh, excuse me, what we want to talk about in terms of well-being, specifically in healthcare. Now, this was a study we ran a couple of years ago with a very large healthcare system in the United States. They have about 200 different hospital systems. So very large healthcare system. And they were having a significant challenge. The challenge that they were facing was one of nursing turnover. So we were coming out of the pandemic, which had been such an incredibly high stress, just a high, I don't even know how to say it other than high stress, almost catastrophic levels of stress on the system in healthcare. And there was just a tremendous amount of nursing turnover that this organization and others were facing as well. And they were looking at how do we reduce this nursing turnover? Because there's so much impact, both on costs to the bottom line of nursing turnover, but also to patient care, right? As we start losing institutional knowledge and we're constantly training new people, and how is that impacting our ultimate patients and the outcomes we're looking for? So they started working on this. And here's what is so interesting about this. Oftentimes when we experience a problem like turnover and retention, it's easy to look at this, and many of the organizations that we worked with started this way, looking at this as a math problem, right? We're paying nurses this much money and they could go over to the hospital next door and make that much money. So of course they're leaving, right? This is a math problem. And if you think about this as a math problem, then how do you solve that? You go to the CFO, the chief financial officer, and say, we need more money for nurses. But what if you thought about this not as a math problem, but as a behavior problem? And this is what we help this organization do, thinking about it in terms of behavior and influence. We looked throughout the organization for what we call positive deviance, places and pockets in this organization that weren't experiencing the same high rates of turnover. And we found them. We found that there were some floors in a hospital that were not experiencing turnover in the same way that other floors in the very same hospital were experiencing it. Some hospitals were not experiencing it in the way that other hospitals in the same city were experiencing it, right? So what is the difference here? And as we looked into the data about how those employees were experiencing their workplace, we found 3 amazing things. We found 3 things that if nurse managers did, they created a culture where employees stayed, even in the same economic situation, right? So it wasn't about economics. It was about what were these managers doing? And here's what we found. There were 3 vital behaviors that nurse managers had to do. First, help. My manager helps to remove barriers that could prevent me from doing my best work. If nurses scored high on that, they scored their nurse manager high on that behavior, they were more likely to stay. Second, care. My manager cares about me as a person. And finally, growth. My manager is actively involved in helping me grow. And I apologize, I'll correct that slide there because it was definitely growth. My manager is actively involved in helping me grow as a professional. When nurses scored their manager high on those three measures, they stayed. The employee turnover rates were so much less in departments in which their nurse manager scored high there. So when you start getting that kind of data, you see, wow, there are specific concrete behaviors that when nurse managers do, they can immediately and in a sustainable way impact our problem of employee turnover. This isn't a math problem, it's a behavior problem. So as we think about vital behaviors, one last thing on vital behaviors that you have to get so good at is, and this is where I think most of us go wrong as leaders, is we are not specific enough about what the behavior is that we're looking for. So to give you an example of this, I just want to show you a fun video from our Crucial Influence training course. And I want you to watch, we've got two leaders here on the screen. This is Savannah and Lonzo, and they are presenting to a group of their management about the kinds of things they'd like to see from their managers, right? How they want their managers to influence people and to engage with their employees. And I want you to watch for, first of all, what goes wrong here? Like, what are Lonzo and Savannah not doing very well? And then, and most importantly, what's the impact on people when leaders give this kind of direction? So let's watch.
We have a leadership problem, a serious one. And if we want to build this into a great organization, we need to change.
Exactly. Lonzo and I have developed a new leadership initiative. I mean, there's a lot of things we can do, but we want to focus on a few key behaviors that will make a real difference.
So we came up with a list of the 21 most important things our leaders should do.
The first thing is put people first. Beautiful synergy there. We want this on all levels. Yeah.
I really don't understand. What exactly are you looking for?
We need to cultivate a culture of connection. We want people to feel like a team, but not too close, because that would be inappropriate.
The second thing is you need to increase accountability. This one is huge. And when we say this, we don't want there to be any confusion.
I don't understand. What exactly do you mean?
You know, it's like I always say, you can count on me to be accountable because when we account, we count. You know what I mean?
Which leads me into the third thing you should do. Lead with courage. Great leaders take risks. They're bold, they see what's ahead, and they go after it. But be careful. Don't be too rash. And don't do something that will hurt the company in the long run.
Or even the short run.
That's right. Be bold, be courageous, but be right. And that will be the right way to lead.
All right, let me see if I have this correct. You want us to lead the right way, not the wrong way?
Yes, well said.
Okay, let's move on. The next thing we want to talk about is promoting clarity.
All right. So I would love you to just chat in. What went wrong there and what was the impact of it? What did you see as you watched Lonzo and Savannah try and share the behaviors that they want to see from their managers? So many buzzwords. I know 21 things to do, right? Absolutely. There no specific actions, no clarity. Yes, absolutely. And as you think about this, again, kind of, I love these answers. What was the impact on the people? How did the people in the room react to this? They're totally unclear. They're completely fuzzy, disconnected. Thank you. I love this word, disengaged, right? One of the biggest challenges we have is that we as leaders have this vision of what we want to create, right? And so we go out and we say, here's what we want. We want accountability and clarity and integrity and honesty and care and mutual purpose. We put out all these buzzwords that mean something to us. but they are not specific about what they want that other person to do, about the behavior they are trying to influence. And the impact of this is important because it's not just that people are like confused, it's that they become disengaged, they become frustrated, they become apathetic. You actually do more harm when you do this than if you had done nothing, right? Because you really start to disengage the very people you're trying to influence. So one of the key one of the key things you have to do in influencing people is get really clear and really specific about what it is that you want them to do, the behavior you want them to do. We like to say it this way: clarity is the precondition of influence. If you are going to influence, you must first have clarity. And the very best way we know to help leaders create that clarity is to help them define when and what. Identify when people should act and specifically what they should do. And I want to give you a quick example of the level of specificity I'm talking about. This is Matt Van Branken. He was a CEO of Spectrum Healthcare in Grand Rapids, Michigan. And some years ago, we worked on an influence project with him in which we improved hand washing compliance from 50% to over 97% in a 10,000 person health system. And note this at the bottom, in 1 month. We were able to bring those rates up in 1 month. We changed that behavior and then sustained it. And part of the reason we did that is because of the specificity of the behaviors. They had 3 behaviors. First, wash in, wash out. It was very clear to everyone that when you entered a room or when you exited a room, you needed to wash. So you get that specificity of what I do and when I do it. Now, interesting enough, and this is why I wanted to share this example, is they had 2 other behaviors. They had 2 other vital behaviors that we influenced as part of this effort. And the second, I like to think of these as what I call recovery behaviors. And here's what I mean by that. When you have an influence strategy, so if I want to influence hand hygiene and hand washing behaviors, and my strategy is everyone wash in and wash out every time you enter a room, well, that will be great. And if everybody does it perfectly 100% of the time, we will absolutely impact the rate of hospital-acquired infections, like no problem, if everybody does it perfectly every time. But I am here to tell you that if your influence strategy relies on everyone doing it perfectly every time, you will fail because nobody will, right? Like there's no perfection in the world that way. And so the very best influence strategies often have what I like to call recovery behaviors, right? What do we do when people don't do the vital behavior, right? How do we have that built-in redundancy? And what the folks at Spectrum Health did was they had 2. It was so interesting, so fascinating to me. And it says actually a lot about healthcare and their healthcare system. The second behavior was 200% accountability is what they called it. And the behavior specifically was, I'm 100% accountable to wash myself. And I'm also 100% accountable to speak up when I see you don't wash, right? I'm 100% accountable for me and 100% accountable for you. And so the behavior was, when I see someone enter a room and they don't wash, I speak up about it, right? So that was their recovery behavior. Now, interestingly enough, when we first started the engagement, we thought that was all they needed. But as we started working with them, we realized, oh, that's going to be a problem because people were very, very hesitant to speak up, especially that housekeeping staff or that CNA, that certified nurse assistant, someone that was fairly low on the power hierarchy, was very hesitant to speak up to that physician when she didn't wash her hands, right? And when we said, what's the problem here? They said, well, because they get angry with us or they're frustrated with us or they say, don't talk to me that way. And so what we did was we introduced a third vital behavior, which was, when you are reminded to wash your hands, say thank you and wash your hands. That was literally the behavior that we put an influence strategy around to drive. And with these 3 vital behaviors and the strategy around them, as you saw on the previous slide, we took hand hygiene compliance from 50% to 97% in 1 month, and it stayed there. But a huge part of that was the clarity around the very specific vital behaviors. Now, what I want to do is next turn our attention from those vital behaviors, right? Those very specific vital behaviors, and say, once you've got those vital behaviors, you have to decide how to influence them. And I want to introduce you now to our 6 source model. So I'm going to use a little example here, sort of an employee engagement example in the spirit of employee well-being, and think about why it is that people do what they do. So imagine that this is you, right? And you've just taken on a new role and you're like, I am so jazzed about this and I'm bringing all my energy and all my engagement. I just know I'm going to really love this job. And then this is you about 2 months into the job, right? And you're like, I get up every day just frustrated and discouraged and unmotivated, and I don't want to do my job, and I'm not bringing any of my best energy or self to it. And the question is, why? Why has this behavior and this attitude changed so much? Well, the quality of your answer to this question, why are people doing what they're doing, is the best predictor of your influence. Here is a great challenge when we start to influence behavior. We almost always jump from behavior to influence strategy without ever first stopping to diagnose and to ask ourselves, if this is the behavior I want, why are people not already doing it? It's so important to think about diagnosing before we start to influence. And here's why. Again, right, so many of you are in healthcare. If you think about going in to see your healthcare provider and you're like, oh, I have this symptom, I have a fever. And you say to your healthcare provider, I have a fever. And she says, oh, great, here, let me write you this prescription. I want you to take this medication. Wouldn't you stop and say, wait, don't you want to do some tests or a physical exam or hear more about my other symptoms or how long I've had the fever, or, don't you want to do some sort of diagnosis? We would be shocked to have a healthcare provider start to prescribe before they diagnose. And yet we do it all the time as leaders. We get an influence challenge. I want people to do this behavior. And we immediately jump to, how can I get them to do it? In fact, my guess is you probably all did that about 30 minutes ago. When I said, how can you get them to use the restroom? We all start thinking, oh, I could do this, I could do this, I could do this, without necessarily stopping first to clearly identify why they aren't currently using the restroom. Why are people doing what they're doing right now? This step of stopping to diagnose and understand the current state of behavior is so crucial if we are going to be successful influencers. So the quality of your answer to why are people doing what they're doing is the best predictor of your influence. And what we want to do is give you a model for thinking about how to answer that question. And it's based on social cognitive theory by Albert Bandura. People do things for 2 reasons, right? Motivation, because they want to; ability, because they can. But what we have done with the 6 sources of influence model is we have expanded that, because as it turns out, no one lives in a vacuum, right? We are all influenced by the world around us. So I want to introduce to you briefly the 6 sources of influence. And let's go back to our example of our disengaged employee who was coming with so much energy and vitality and now is so apathetic and disengaged, and say, why? What has been this change? Well, source 1 is what we refer to as personal motivation. So again, you're going to see 6 sources here. We've got motivation and ability. And at this first level, we are looking to say, what is their personal motivation or their personal ability? So personal motivation might just be, I don't actually enjoy this work. And you know what? I'm not gaining any valuable experience. That's why I'm not bringing my best self. Source 2, personal ability. Maybe it's that I'm struggling to be able to master certain parts of my job. Like, they're hard. I don't have the right skills for this. So something about my personal ability is impacting how I'm showing up in my job. Now, those are the 2 that we tend to start with, right? What do people's ability and motivation say about them? But the next row down is so crucial. It's, how do other people around me impact my motivation and my ability? So source 3, or social motivation. This is the impact of others around me on my motivation or desire to engage in a vital behavior. In this case, maybe there are team norms that are pulling me into bad habits. We are social creatures, right? We are very attuned to what others are doing and often try to norm our behavior to those people. So how are those team norms impacting me? Now, source 4, or social ability, is a little different than social motivation. If you think of source 3, or social motivation, as how do other people impact my desire or more motivation to engage in a behavior, source 4 is, how do other people impact my ability to engage in a behavior, right? So maybe I'm not getting the coaching or the direction from managers and leaders that I need, the help that I need from them. I tend to think of source 3 and source 4 in this way. Source 3 is sort of peer pressure, social norming. Source 4 is teamwork, right? Where we say, hey, we put people together in teams because we know when people work together, we get better results. We need one another in order to be able to get the kind of best results that we're looking for. So, social ability, source 4. Now, it's not just other people that impact both our motivation and our ability. It's also the structure around us. And so much of this came out in our bathroom example, our Out in the Pond Airways bathroom example, right up at the top of the webinar here. So you guys are experts in structural motivation and ability, right? So structural motivation, or source 5, is this idea of what are the things in my environment that are impacting my desire to engage in the behavior. So these are things like pay and perks and incentives, or even the formal discipline system, right? It's the carrots and the sticks, the rewards and the punishments, that the things that impact my motivation to engage in a behavior. So for our disengaged employee, maybe I don't feel fairly compensated for the extra work that I'm doing. So I'm going to stop doing it, right? Absolutely, because I don't feel like there's that structural motivation in place. And finally, structural ability. What are the things in my environment that impact the way that I am able to engage in a behavior? So these would be things like tools and processes, geography, location, right? All the things in my environment that impact my ability to do it. So in this case, the case of our example here, systems and processes are broken, so it's hard to get anything done. And one note on that is you think about structural, and for that matter, social and personal ability, that ability column. I love the word on this slide that says it's hard to get things done. Not impossible, but hard to get things done. So often when we're trying to influence others' behaviors, we have a tendency to think about it as ability as a binary. They either can do it or they can't do it. It's possible or it's impossible. And we think about this real binary. You will be more successful in influencing if you think about ability as a spectrum between hard and easy. Right? Anything I can do to make it easier, to reduce friction, to make it easier for people to engage in the behavior, for them to be able to engage in the behavior, the more likely they will be to engage in the behavior. So again, don't think about ability as, well, they could do it if they really wanted to. No, think about it. How can I make this easier as they go along, right? Yes, I love it, Francis. Thank you. Right on. Exactly. We need to make the right things easy. And the flip side of that is make the wrong things hard, right? Where do we want to actually introduce friction into the system so that people won't head that direction and they'll head the other direction? So I love that. I love that. Now, here's what we have learned about the 6 sources of influence and the power of this particular model as thinking about it as a way of, again, kind of lenses through which you can look at human behavior and answer that question of why are people doing what they're doing. We have found that using these full 6 sources really helps us to understand more fully why people behave the way they do. And this is the key point. This is the key point that I hope you will take away from this part, which is this. Your world is perfectly organized to create the behavior you're currently experiencing. So if you look at and you think about all those influence challenges we talked about at the beginning, the reason those are happening is because that's how the world is organized right now. The people are behaving in a way that is very predictable if you can see those 6 sources of influence around them. So if you want a different result, if you want people to behave in a different way, you need to change the way the world is organized around them. You need to take those 6 sources and say, what can I do? What levers can I pull here in these 6 sources of influence to start driving the behavior I want? Now, in the Crucial Influence course and in our Crucial Influence consulting work, we go deep into all of these sources. We have like 15 minutes. We're not going to go deep, but I want to give you just a couple of ideas about a few of these so you can start catching that vision of how could I use some of these sources of influence in maybe ways that I haven't thought of before to drive behavior. So I want to start with, but first, before we do that, I want to start with this key point. Oftentimes when it comes to influencing, we think about it like, and I want to use this metaphor of, I've got my car, It's stuck on the side of the roadway, and it's dead, right? I've run out of gas, whatever it is, and I need to push it out of the way and push it on my way. And so imagine that you've got this car that's stuck, and the 6 people inside the car, they pile out of the car, and we say, oh, this car is stuck. Let's start pushing it. Let's see if we can get it off the roadway and where we need it to go. And so that first person says, hey, I'm strong. I've got this. Let me push. Oh, and that one person pushes hard. No, it doesn't work. It doesn't work. They don't go anywhere. So then someone else says, here, get out of the way. Let me try. And that next person pushes. Nothing happens. And all 6 of these people, one by one, try and push this car out of the way. And of course, nothing happens, right? But, and this is pretty obvious with the car, if we all get together and push, it's pretty easy to move that car right out of the way, right? When we all push together. This is the key about the 6 sources of influence. So often when it comes to an influence strategy, we try one thing. We say, oh, I need to use this. We're gonna install fountains. We're gonna do drink coupons. We're gonna do whatever. I've got this brilliant idea. Here's how we're gonna influence the behavior. And then we try that one thing and it doesn't always work. And then we're frustrated. The key of the crucial influence methodology is this. You need to use all the sources of influence at once. And in fact, as you can see here on this slide, we have a fantastic research paper. Josh and Amy and team are going to send it out to you after this webinar. It's called How to 10x Your Influence. It was an MIT Sloan Management Review article of the year several years back. And what we found in this study was that if you use 4 or more sources of influence in your strategy, in your influence strategy, if you've got different levers that you're pulling from 4 or more sources of influence, you are 10 times as likely to be successful. There was this huge leverage point, this huge tipping point, where when people who just use 1 or 2 strategies as part of their influence plan, they weren't very successful. But if you use 4 or more, you are going to be 10 times as likely to succeed. So that is the key idea. We want to draw from all of these influence strategies as we start to try and influence behavior. So with that, let me just, again, draw on a couple of these sources of influence and give you a couple of ways of thinking about them. So first, source 1. And actually, I love it. And I can't remember who it was, but someone in our first opening icebreaker around the air, using the restroom on the plane, suggested explain the why. Connect to those values, right? How can we tap into and connect to people's values to try and drive the behavior? So with that, here's a little example. Say, for example, you are a safety leader at a bus service company, and cyclist fatalities and injuries have gone up each year for the past 5 years. So here's the problem. Your bus drivers, they speak very dismissively of the bike riders, often blaming them for carelessness, right? They got in my way, they darted in front of me, they jumped into traffic. So here's the question. How could you influence these bus drivers to have more awareness and empathy for the cyclists? Well, we might think of bringing them all together and giving them a motivational speech, right? Putting them on a webinar or something like that. Maybe we're going to give them cues and email them reminders to be like, hey, watch out for the cyclists, etc. Well, I want to show you what the city of San Luis Potosi in Mexico did. And it was so successful. Now, let me say before I show this, I'm not sure that, at least in the United States, I don't think that we could legally do this to our bus drivers. But I want you to look at what they did and why do you think it worked so well? So again, we're trying to get our bus drivers to have more empathy and understanding of these cyclists so that they will be more aware of and change their driving behaviors. So here's what they did. Yes, they put their drivers on these stationary bikes and then they drove the buses right by. Why would that work? Why would that have such an impact on the bus driver's behavior? Go ahead and chat in. I would love to hear your thoughts on why does something like that influence behavior? Why does that influence behavior? Yes, right? Exactly. Walking in their shoes, giving them that learned experience, that lived experience, really making it personal. Exactly. As we think about ways to engage people's personal motivation, to give them the desire to want to change their behavior, you can think about our different strategies as along this kind of continuum. And at the high end, personal experience. When people have a personal experience, they are much more likely to change their behavior. On the low end, by the way, is verbal persuasion, which is probably what we try the most of, right? I'm going to tell you why you should change. I'm going to tell you why this is so important for you to change. And we try to persuade them, right? But personal experience high. Now, the challenge, of course, with this is we can't always create the personal experiences we want, but sometimes we can kind of split the difference between verbal persuasion and personal experience by creating a vicarious experience. And let me give you a quick example of this. So there was a college fundraising call center in the United States several years ago. So they did was they brought student workers in. So these are students at university, and they are calling alumni to try and solicit donations. It's not fun. The work is boring, unpleasant. There's really high turnover. They get told no a lot. They're just sitting, calling, and asking for money. It's not a fun job. But what they wanted to do was see if they could reduce that turnover. And so what they did was they had scholarship students come in and share their stories once a month. So once a month at an employee meeting of these student callers, they would bring in scholarship students who were there at that university on a scholarship. Many of them were first generation university students who were going to work in public health fields, for example, or other public services. And they came in and they talked to these students about how much of a difference it had made in their lives and their families' lives to be able to attend university. And they were able to do it because of the fundraising efforts of these call center students. And once they started influencing these call center students by, again, once a month having them come in, they found that their student workers spent 142% more time on the phone and generated 171% more donations, revenue donated, right? So they had a huge impact on the students' behavior. And it was because they connected with how these students felt about the work. The work didn't change. It was still kind of boring and unpleasant, right? It still wasn't fun. It was the exact same work, but they changed how students felt about it. When you change the value connection, you can change how people feel. So that's the first one in source one, is think about how you can create these vicarious experiences to connect to people's feelings. Now, I'm going to very, very quickly do source 3 and 4 because I want to leave some time for Josh and for some questions here at the end. So let me talk just really quickly about sources and 3 and 4, which are so powerful. They are so powerful. Did you know? So let's talk about social influence really briefly here. Did you know how you feel is contagious? Happiness actually spreads. They've done studies that shows that happiness spreads among people up to 3 degrees removed from one another. So what that means is that when you feel happy, a friend of a friend of a friend has a higher likelihood of feeling happy too. It is socially contagious. How amazing is that? Did you know that we will follow the rules if others do? One study found that simply telling people that others paid their taxes on time increase the likelihood that they would pay on time too. We are social creatures. We are trying to social norm around others. And one of the most powerful social influences for most of us in our workplace are our leaders. We do what leaders do. Every hour a leader spends working after hours translates to 20 minutes of after hours time spent working by their direct reports, even when that's not what the leader wants or expects. We tend to norm ourselves again around those we are with. One of the most powerful ways to think about it is this: who you're with is how you act. We are so influenced by the social influences around us. Now, as you think about that, what that means is that we need to engage in our social influence efforts, engage our opinion leaders, those people in the organizations that are highly connected and have a direct impact on the behavior of those we are trying to influence. Unfortunately, I've left our time a little short, and so I'll come back to opinion leaders in the question and answer if we have time for it. And I can tell you a great story, which I'm going to skip ahead. Sorry about finding opinion leaders. Because what I want to do is end with, before we go to Josh, is end with this last video example of how the power of bringing all of these social influences together. So this is a little video experiment we did with some kids to see if we could influence their behavior and how the sources of influence mattered. Let's watch this, and then we're going to take some time for Q&A.
What you're about to see is real. Real kids doing real things. Just thought you should know. My name's Hiram Grenny, and I was there for the whole thing. So here's a question. What does it take to get people to change? And I'm not talking about their socks and underwear, but change behavior, especially when it's hard. For example, every year close to 100,000 people die from hospital-acquired infections. That means people got sick at the hospital. And it turns out one of the main culprits is hand hygiene. That means just getting people to wash their hands could save lives. So my crack research team decided to conduct an experiment to see if we could change something as difficult as hand washing habits, only with the toughest subjects of all, kids. So here's what we did. We took 80 munchkins and put them into groups. First, we gave them a challenging puzzle to put together. You know, kind of like the projects you adults are always busy with. Then, we gave the kids a tempting distraction.
Hey guys, I got the cupcakes for you right here. They're delicious. I'm gonna set them right over here.
Once I see that you guys have put the whole puzzle together correctly, I'll raise my flag, just like this, and then I'll blow my whistle. Okay, and when I do that, you guys can all go and get your cupcake. So what would it take to get these kids to wash their hands? How about a good reason? So one thing you guys should know, there was a sick kid in here playing with the puzzle pieces. He had a runny nose and coughed a lot, so there's probably a lot of germs on everything. But there's hand sanitizer over there on the table that you can use to wash up. Okay, which will win out? Delicious frosted cupcakes or the fear of the typhoid toddler? Let's watch. They finished their task, and look, if the threat of one sick kid wasn't enough, just look at all the new germs popping up. So with all those good reasons to wash, what do you think they'll do? Okay, so that was a colossal failure. Now what? With the next group of kids, I changed the environment by moving the hand sanitizer closer, and then put up a visual cue. This ought to make hand washing easier and more obvious, right? And in the end, the motivation to not get sick plus changing the environment didn't influence a single kid. Yikes! Next, I increased their ability, which is another source of influence. I had them all complete what is known as deliberate practice, or training, to increase their familiarity with good hand hygiene. Will adding another source of influence get these hand-washing offenders to wash up? Done. And... well, now we're seeing some better results. We're combining 3 different sources of influence, and some of the kids are actually washing their hands. It looks like we're on the right track. So next, I added another source of influence, social influence. What if somebody spoke up and said something? What would happen if their bosses were in the room with them? Here come the cupcakes. And there goes the flag. Will they wash? No! Look at them pouncing on those cupcakes like a pack of ravenous hyenas. But it's not too late, because something important happens. At just the critical moment, a peer, not even one of the bosses, speaks up.
Wash your hands.
Watch the effect. Success at last! So social motivation obviously made a difference. But was it the only thing that mattered? What about our other sources of influence? Here's what my kids had to say.
This sign. I was walking over to get my cupcake, but then someone said, wash your hands, because this boy had the sniffles in here.
So what's the point? We often underwhelm overwhelming problems. We try a couple of things, and when they don't work, we give up. But my dad and his colleagues discovered the secret to overcoming tough problems. You need to combine at least 4, preferably more, sources of influence. And it doesn't matter if you try it with kids or hospitals, at the office, or even at home. If you use 4 or more sources of influence, your chances for success go up 10 times. 10 times! So there it is. The key to changing almost anything is to marshal the power of at least 4 or more sources of influence, but preferably all 6. And heaven knows, we need it.
All right, so just a fun example there showing how if you bring all of these sources of influence together, you can drive that behavior. And the way we like to frame this is if behavior isn't changing, you aren't leading. At the end of the day, influence is intentional, or leadership is intentional influence. That's what leadership is. Now, we are almost out of time. We are going to do Q&A. I hope some of you can stay on a little bit longer. I absolutely can. But before we do that, Josh is going to just tell us a little bit more about how you can continue to engage with and learn more about Crucial Influence. So as you listen to Josh, start chatting your questions in, and we will stay for Q&A. So Josh.
Thanks, Emily. Amazing as always. Really, really enjoyed that. And I reflect a lot on many years previously in other roles going, I wish I'd understood this a little earlier. So thank you for sharing that. I won't hijack too much time. So we've ticked off this webinar. It is part of a series that we're holding. So the next one is really around the, caring accountability and how that builds performance and addresses wellbeing in organizations. So really looking forward to seeing you guys at that. In terms of the next steps following this, we will, there'll be an email that we provided to all attendees, which will have the 10 times influence ebook, which we've mentioned. So I really encourage you to read that. Fantastic insight into that, as Emily's mentioned. And we're also going to be doing a further deep dive into Crucial Influence, which we call a virtual course preview, which we'll be doing on Thursday, May 22, and that's at 11 AST. So yeah, really looking forward to seeing many of you there. Thank you for making the time today. And we'll basically now, if you've got any questions, please put it into the chat. We'll hold on for a little bit longer, and Emily's making her time available. So thanks.
Yes, perfect. Thank you, Josh, and thank you so much to all of you. I know several of you, and I appreciate your comments as you are explaining. Yep, you have to drop off because we've come to the end of the webinar. If you do have questions, would love to stay on for them. And again, I'll just reiterate what Josh said. The Crucial Influence virtual course preview. It's a great way to learn not only more about the Crucial Influence model, but also about the training course and how you can bring it to your organization and really drive impact in helping empower all of your leaders to drive change in your organization. So very good, very good. So I would highly encourage that. In fact, why do we need the slide that says Q&A? I'm going to leave this one up there so that you can get that date and time. Yes, okay, let's talk about opinion leaders just a little bit more because this is so crucial. So one of the things that we have found and is that again, that many people, that we are social creatures, we are influenced by those around us. And you know that is true when you're like, oh, right, like, why are you doing this? Well, because this is what this other person is doing. And so one of the things that we have found is so helpful with opinion leaders is if you can identify the handful of opinion leaders in your organization and get those opinion leaders on board in your change initiative, they will then propagate that initiative through the organization. I tend to think of opinion leaders kind of the same way I think about vital behaviors. So the idea around vital behaviors is I just have to get a couple key crucial vital behaviors. And if I can get those in place, that will domino out and influence a whole host of outcomes. Likewise with opinion leaders, I don't have to influence 10,000 people. If I can influence the 100 opinion leaders in my organization, they will influence the 10,000 people for me. Now, what's interesting about this is some of this and some of the great work around opinion leaders was actually done by a scientist named Everett Rogers. And he wrote an amazing book called Diffusion of Innovation that talked about how change happens in a system, how innovation or new behaviors, new changes are diffused in a social system. And what he found is that change always follows an S curve, right? It always follows an S curve. It starts with just a handful of a few people. He calls them the innovators who are like, oh, there's a new change. Let's change. It's so exciting. And those innovators start changing first. And then follows what he called the early adopters, then the early majority, the late majority, and finally, up there at the top of that S curve, the laggards, right? The people that like, they are just now getting a microwave for the first time, a microwave oven for the first time, right? Like this is so late to adopt anything. And what Everett Rogers found was really, really interesting in this S curve, and it ties exactly to opinion leaders. He found that the people that you want to engage in your change effort are not actually the innovators. Those people on your floors or in your units in the hospital who every time you introduce a new plan, they're like, oh, yes, that's great. Let's do it, right? They're just so anxious and eager and excited. But often those innovators, they are not socially connected. And in fact, they are often seen, maybe disparagingly is too strong a word, but they're dismissed by the others in the organization because they're, oh, that person, they want to do everything. They just, they're always on board with everything. They don't, they're not credible. But what he found was that next group of people, those early adopters, they were socially connected and they were credible. Those are the people who they're going to look at the information. They can be persuaded. They'll look at the data. They'll look at the reasoning and they'll say, yeah, I could do this. Like, this is a change I'm interested in. And those early adopters, once you start getting them, that's what gets your S curve going in change, right? They bring the early majority and the late majority along with them. So you want to try and identify those opinion leaders. And actually, I'm going to jump back a couple of slides here for this. I could have done this earlier. What we found is the very best way to identify opinion leaders, and here's how we do it when we go in and consult and on consulting engagement with clients, is we just do a survey. And we ask, right, if your manager wasn't around, who would you look to for help? Who would you look to for information? Who would you go to ask about something? And what we find is there's a couple of people that are named once or twice, and you kind of think they're probably writing themselves down, right? And then there you get to people who are named 20, 30, 40, 50 times, right? They come up. Those people, those are your opinion leaders. Those are the people that you want to identify and then bring in as part of your change initiative to drive that change forward. So a little bit about opinion leaders. Is there anything that you found to be more influential in kids than in adults? I have some thoughts on that as a parent of children, but honestly, we have not done necessarily research on which, if there are sources that are more or less influential on kids than adults. What we have found is that the 6 sources of influence do influence kids just like they do adults. How do you recommend to identify opinion leaders? Great, we talked about that. Truly, it's so simple. A survey. A survey is one of the very best ways to recommend to identify those opinion leaders. Discontent and influencers. Oh, Sandra, this is a really good question. So just if you'll indulge me for just a moment with a story. So some years ago, a colleague and I were working with a row cropping organization in the United States. So this is like a farming organization. They sort of manufactured everything that you'd need for row cropping. So seeds and fertilizer and machinery and sprinklers for water and irrigation and all of that. Anyway, we were working on an influence change with them. And as part of that, we needed to identify opinion leaders. So we'd done a survey, much like I was just talking about, and we got a list of about 10 people. And we brought it into the CEO to say, okay, here's your opinion leaders. These are who we need to engage. And so he's reading down the list and he's like, oh, yep, that person. Oh, yeah, I can see that. Oh, that person. Yep, I can see that. And then he gets to one name on the list and he was like, oh, no, this guy's not an opinion leader. No. He's always negative and he's ornery and he never wants to do anything new and he's stuck in his ways. He's not an opinion leader. Take him off the list. Now, of course, he was an opinion leader, right? He'd been identified by others as an opinion leader. He just was leading in a direction that we didn't want to go, right? So often your opinion leaders can be people who are disgruntled or discontent, right? It's not about whether they're for the change or against the change. That's not what makes them opinion leader. What makes them an opinion leader is, do others listen to them? And one of the most important things you can do often is find that disgruntled or discontent opinion leader if you can, and connect with them and try and bring them around to the change. Now, this is hard and it's super labor and time intensive, right? It can take a lot of time. But what the data suggests is if you can get that opinion leader, if you can get those opinion leaders to switch, they're going to bring everybody else along with them. So rather than trying to influence the masses, you try and influence the few. Yes, I can totally go back to that slide. Let me, I think I have a good one of those right here. So if you want to, yeah, this, okay. So I'm gonna show you two of these, Francis, in case you want to screenshot them. Although Amy and Josh are gonna send the recording out after, but this is a great one to screenshot. So we have two versions of this of the 6-source model. One is the diagnose. In fact, now I'm going to do this. Come back to this one. This is the diagnose version of the model where we say, these are the phrases that will help us diagnose. Do they want to? Can they? What praise and pressure is around them? Is there help and hindrance? What are the rewards and punishments? What are the structures, environments, and tools that are influencing them? So this is the sort of like, how can I use the 6 sources of influence to understand why that behavior is going in the direction it is? Then, and hopefully you've got what you need there. Then this version of the model, and obviously we go through all of this in our training courses and in our consulting engagements. This version of the model is about how do you drive or influence. So for social influence, for personal motivation, source 1, you want to connect to people's values. For personal ability, you want to invest in deliberate practice. You want to provide encouragement, assistance, reward with care, and change the environment. So those are there's sort of, I just wanted to call out that there's 2 different versions of the 6-source model because you use it in 2 different ways. First, to diagnose and say, why aren't they doing what they're doing? And then second, to say, how can I help move that direction? Okay, great. Okay, wonderful. I think I got the questions that were there, and I'm so grateful to those of you who could stay on 10 minutes longer with us. Yes, is there a QR code? I don't like, that's a great question, Joe. Okay, yes. So here's the QR code for our next and final part of our series. This one, we're going to talk about accountability. And by the way, if you've been with us for the first 2 parts of the series, this is going to bring it all together. Because in crucial accountability and in talking about how do we create really sort of empathetic and caring accountability, we are going to be talking about 2 things. And we're going to bring sort of conversations and influence together in the sense, I'm just giving you a little preview here, in the sense that accountability is really about, there's a gap between what I'm expecting and what's actually happening. And I need to figure out how to close that gap. And I'm going to do that through conversation with you. But I need to understand human behavior because ultimately it's a behavior that's causing that gap. So we're going to bring together some elements of the 6-source model, the 6 sources of influence that we just talked about. And we're going to bring together some elements of crucial conversations. And we're going to look through that at the lens of how do I show up in that moment where you're not doing what I need you to do, where we've got a performance gap or a problem, but how do I show up well in that moment to bring that caring, empathetic accountability to really drive the results we want while creating the culture that we want. So I'm really excited about that next session with you. Yay, Paula, I agree. Thank you. Thank you so much. I think so too. And then, oh, yes, thanks, Josh. So if you didn't see the first webinar, but you would like to go back and watch it prior to the account, you don't need to, but if you're interested, Josh has added the link to the first webinar that we did around Crucial Conversations. So that's wonderful. Wonderful.
No, I think that's
All
great,
right.
Emily. Fantastic. Thank you so much for your time, your energy, as always, and insight. I learn something new from you every time you speak, which is fantastic. Folks, thanks for the time. I know we've gone over. An email will be coming out, as I mentioned. We'll have the recording. We'll have the 10 times influence ebook. We'll have the registration for the course preview. And we'll also probably pop a link in there around the previous webinar as well for those that dropped off and requested that as well. But thank you everyone for your time. Have a lovely week, and we'll hopefully see you on the next webinars. Thanks, Emily.